Hello everyone, I am Dr. Naresh Bansal from Mind Vision Hospital, Ludhiana. Today we are going to discuss another important topic that are panic disorders. So panic disorders are a type of anxiety disorders which are characterized by having recurrent panic attacks. So these panic attacks are spontaneous without any preceding warning signs and can occur at any situation. So panic attacks are characterized by following symptoms. There can be nausea, vomiting, there can be profuse sweating, sudden onset of profuse sweating, palpitation, tremors, then there can be symptoms of dizziness, feeling of going crazy, fear of dying, as well as there can be respiratory symptoms like choking and shortness of breath. Panic disorder is said to be moderate if there are 4 panic attacks in a period of 4 weeks, and panic disorder is characterized as severe if there are 4 or more panic attacks within a period of 1 week. So friends, these panic disorders are treatable. You can very well imagine the life of a patient who suddenly has these type of feeling of profuse sweating, diarrhea and fear of dying at any situation, and there is no warning sign. Then that patient can always be worried at any situation. So panic disorders can then lead to agoraphobia. Like patient can be worried that he can get trapped into places where escape is difficult. Like patient has fear of going into public places. Patient has fear of going into crowded places, and patient has fear of going alone in a bus or a train. So when patient feels that he cannot escape from that situation and he suddenly has a panic attack, what will he do? So these type of fears then lead to another disorder called agoraphobia. So these two disorders, panic disorder and agoraphobia, are usually associated together. Panic disorders are treatable. There are 2 types of treatment, pharmacotherapy and psychotherapy. With pharmacotherapy, these are almost managed on day 1. We can give SSRIs and benzodiazepines, which are then slowly tapered off. Along with this pharmacotherapy, psychotherapy is also used for the patients of panic disorder. In this, the patients are taught that these panic attacks last for only few minutes. So he needs to recognize that these are not actual sudden impending death symptoms. These are actually only fear of dying, and he needs to stay on. So once we correct these faulty thoughts, then the disorder can be abated. Along with that, we can tell the patient to participate in relaxation therapy, in which we teach progressive muscle relaxation in response to the panic attacks. When the attacks happen, the patient muscles are automatically getting taut. So with this technique, gradually when the patient keeps on doing it, then the muscles automatically go into relaxation mode in response to panic attacks. Also, along with that, we can teach the patient deep breathing exercises. So like in the panic attacks, there is hyperventilation. So when we tell to the patient and they experience a panic attack, they should practice deep breathing. When they practice deep breathing, so their breathing is not shallow and the respiratory symptoms will not be there. So if you experience yourself, or there are any patients or friends or relatives nearby who has these unexpected sudden episodes of ghabrahat, restlessness, extreme fear, extreme stress, tension, then they can always refer to a psychiatrist, and this disorder is almost 100% treatable. So if you have any questions, you can ask in the comments below. We will be happy to answer as soon as possible. And do subscribe to our channel to listen to more informative videos on various psychiatric problems. Thank you.